My name is Dr. Hana Patel, and I'm an experienced senior general practitioner who trained in England. I recently have become recognised by my Royal College of General Practitioners as a fellow, which is a marker of quality by my peers. I also have an allied interest in coaching and mentoring, and I work as one of the co-leads for South East London, providing coaching and mentoring services for South East London primary care. And I have a symbiotic relationship between two specialities, and that's where my main focus is at the moment. So the reason that I decided to become a doctor, I think, is quite common, that a lot of my peers have similar examples where there was a personal tragedy or a personal loss early on in their childhood, or maybe in their teen years, that led them to the decision to become a doctor. And that certainly was the case for me. I think I always knew that I wanted to become a doctor, but that was sort of cemented in my mind after I saw my great-grandfather pass away. And it was quite a sad time for the family. And as a 4-year-old, I realized that I wanted to make sure that I would help as many people as I could to ensure something like that wouldn't happen to my family again. But I've always been interested in medicine. And I think I was one of those strange children. When anyone asked them what they wanted to be when they grow up, my answer was I'd always want to be a doctor. And I realize now that most people aren't sure of what they want to do. So I'm really lucky that I'm doing my chosen career that I've wanted to do for such a long time. I feel really privileged to be a doctor. And the speciality that I've chosen, general practice, that's quite close to my heart, because my parents, they used to have and own and run their own business, which was a corner shop, which is a convenience store. And I was busy helping them when I was younger, and it was a really nice community feel. And I knew that when I became a doctor, that I wanted to have that sort of longevity of a relationship with my patients, get to know them very well. And as a general practitioner, I think it's really important to be a family doctor. And those are the qualities that I try and maintain in every consultation that I have with my patients, so they feel that they could talk to me about anything that's concerning them, and that we have an open professional consulting relationship, so they can get the best out of our consultation, but also that they feel comfortable telling me sometimes really intimate and personal things about their health and personal well-being. Aligned to this is my passion and interest for coaching. This has come about after working as a GP for a number of years and realizing that I'm actually quite skilled at trying to get to the crux of a problem, particularly when it comes to colleagues in difficulty or distress. And for that reason, I decided to get some formal qualifications into executive business coaching through the NHS Leadership Academy. And I'm really fortunate to be able to use my skills now and help colleagues in primary care, but also clients outside in the world of business who might be going through difficult changes, transitions at work. More recently, I am taking on a lot more mental health coaching clients. And I think this is just reflective of the statistic that 1 in 4 people at some point who are employed will suffer from mental health issues at work. So that's the reason that I became a doctor and a life coach. So as a general practitioner, I really enjoy the patient consultation and the relationship that can develop between a doctor and a patient, and how that changes with time and with different members of the same family. I think that's such a rewarding and privileged position for a doctor to be in, And I think that that's one of the most rewarding things, and why I prefer to have face-to-face consultations. Although with COVID, there is now a range of communication methods, and I do offer messaging and remote consulting on the Top Doctors platform, if that's something that patients prefer. It's also really rewarding when a patient says thank you, and I think most doctors will say the same, that it's the best feeling in the world. So the question of what my patients most value about me and me of them, I suppose I'll talk about my patients first, to say that I'm really grateful that they choose to come and see me, that they feel that they have trust in me as a doctor, and that they value my professional judgment. And what do my patients value most about myself? I suppose it's the fact that I'm quite open, I'm quite honest, and I give patients the time that they need. So patients will often say, I'm really sorry, I think I've gone over the time that we're supposed to have. And sometimes some patients just need that little bit of extra time. And that's okay if it helps them through a particularly difficult period or time. And I like to support my patients too, if they're going through a particularly difficult time with their mental health or their physical health. So I think that's what patients would say about me and what they value about me. So the question of, while working, how I behave in frustrating, stressful and difficult situations, it's hard. Every day is always going to be a stressful, difficult day as a general practitioner. I find that having an emergency chocolate bar in my bag is really good. Other doctors might have medicine, but I have chocolate. Tea is very soothing as well. So I always will ask one of the reception team for a cup of tea. But, you know, with my coaching experience and what I say to clients with my coaching, in my coaching world, just to take things as they come. And if I know I'm going to have a busy day at work, then just accept it and know that there will be points that will be stressful. I might get frustrated. There might be a difficult situation, and just feeling in myself that at that point in time, I need to be present and just deal with that situation, knowing that it will pass. But speaking to colleagues, you know, leaning on my team, chocolate and tea always get me through the day.